I'd like to first throw this to Dr. Jimenez because I'm a little, I want you to get more into the science of why you do things. I mean, it's nice to hear all about your hospitals and your background, but these people want to hear, and I've talked to you about this, and you once said something very interesting to me about that there's a cycle to cancer where the same kind of therapy, it starts to build up an immunity against it, and you have to know, like every 3 months, how to change the cycle. So can you speak to that a little bit?
So for the last hour, for the next hour, I could talk about this, Fran? Yes? Well, a couple of things. For example, in nutrition, we now know, coming out of Johns Hopkins and University of Maryland, that cancer cells are even adapting to a particular nutrition program. So whether you're on a ketogenic diet, on a vegan diet, on a raw diet, Mediterranean diet, we need to switch these nutrition protocols every 3 to 4 months. So that's very, very important. Number two is that one of our therapies is called Oncolytic viral therapy, and I'm sure the doctor has heard about Oncolytic viral therapy because it's the new player in this field of oncology, right? I just came back from a symposium at Harvard and Mass General where a lot of work is being done on oncolytic viral therapy. What is this? This is a virus that selectively attacks cancer cells without attacking normal cells. In doing that, it also upregulates the immune system, and there's plenty of publications on oncolytic viral therapy. The difference is that we use one from Latvia that is non-pathogenic, non-genetically modified, not engineered. So I even take this virus prophylactically, although studies have not been done to see if it decreases the risk of cancer at long term. But more importantly for our patients, this is a totally non-pathogenic virus that targets cancer cells. And to answer the scientific question, there's plenty of publications. If you go to PubMed, there's plenty of publications on this virus. Is called Rigvir, R-I-G-V-I-R, Rigvir. Oncolytic viral therapy, there's publications in Melanoma Research Journal, which you're familiar with, and journals that come out of Scandinavia, peer-reviewed.
Is it a live virus or a dead virus?
It's a living virus.
And it goes right to the site or systemically?
It's administered IM, intratumorally, and also now we're looking at intravenous administration as well.
Can you speak to this, doctor?
Well, we know that immunotherapy is very powerful. The viral therapy that Tony spoke about so articulately, the one from Latvia. Also, there is another one from the United States that is already approved by the Food and Drug Administration. I'm looking forward to seeing how these trials come out with the Latvian preparation as well. So this is available to patients today in traditional medicine as well. It's important to realize that this doesn't have the side effects of chemotherapy, and I think that's one of the reasons you like it as well. But there are other immunotherapies that are also extremely active. 2 were initially approved, a third have been approved. Now there are 2 more that have also been approved by the FDA. So we see that there are lots of immune therapies that are very exciting, and the newest form of those, CAR T-cells, which are modified T-cells that are taken out of your own body, modified, and then re-injected into your body. These CAR T-cells are showing very dramatic improvement in patients with cures that have been seen with these types of cells. And we're doing that at UCLA.
What does the modifying mean?
We modify it in the T-cells to put in antigens that are related to the cancer. So they're modified in that way in the laboratory. And obviously it depends upon different antigens for different kinds of cancers. And so a breast cancer will get one kind of preparation, a leukemia will get a different kind. And UCLA, USC, City of Hope are all working on CAR T-cells at the present time. So this is an exciting time for cancer immunotherapy. Tony described it as how he's doing it in his clinics. We're doing it as well. This is a time where, God forbid, you have cancer or a friend has cancer or a family member has cancer. You have to ask about what types of immunotherapy are available for me. Also look at information that you see on the internet. I'm sure you'll find Tony's approaches there as well, and you've gotten the information about where to find Tony's information. This is something to ask the doctor about. There's a time and a place for everything in therapies of cancer. Some patients won't need anything. Some patients may need immunotherapy. It's time to ask those questions.
And we have a guest coming up later that actually cured himself with immunotherapy. You know, something else, now I'm kind of always afraid of radiation. I feel like, you know, we get so much radiation in everyday life, and then to try and radiate a sick person, it seems like the radiation itself has many, many side effects to it. So, you know, do you think that that's becoming like an antiquated way to address the problem?
This is not your daddy's radiation therapy anymore. Those old machines are out. They produced enormous amounts of burning, enormous amounts of long-term side effects in patients. So today, the research being done in pediatric oncology has recognized the real threat of radiation to developing kids.
Is that because their cell regeneration is so fast?
Kids are growing, and growing cells are more sensitive to radiation. So as a result, there has been research, lots of research done, with huge clinical trials showing how we can eliminate radiation from many of the kids and reduce it. This is also going on in adults, also in the AYAs, the adolescent and young adult population. That's a big challenge to us today to take care of because they have special needs. Radiation is not the same as it used to be, and we have ways of reducing radiation fields. We have radiation protectors that protect normal cells against the side effects of radiation. We shouldn't eliminate radiation as a treatment, however, because it is curative in many different patients, but it should be done carefully. And again, a question for your doctor. Doctor, how are you going to limit the side effects of the radiation that I might need to cure my cancer? And that's a question that will be discussed by your doctor. And if the doctor doesn't know the answer, time for a second opinion.
If I could just add something.
Yes,
one thing that we all should recognize, though, and this is in the literature, this is not Dr. Tony saying it, is that radiation does not kill cancer stem cells, nor does chemotherapy. 99% of a tumor is non-cancer stem cells. Those are the ones that are affected by chemo and radiation, so there's significant reduction in tumor size and tumor burden. But 1% or less are cancer stem cells, and those are resistant to radiation and chemo. Those are the ones that survive in the bloodstream. Those are the ones that lead to metastasis. Those are the ones that become more aggressive. So those so-called recurrences or relapses, really, the cancer stem cells were there all the time. It's just that they repopulated.
and they're not picked up either on like a CT scan or anything.
That's
People
correct.
often will say, I took a CAT scan post-op treatment and I'm cancer-free. And I think to myself, you know, that is only going to pick up once it's a certain size cancer.
And that's why even a patient that's in remission and is getting PET scans every 6 months, every year, or CAT scans, you know, that's dangerous also because a PET scan is about 100 times more radiation than one chest x-ray. And a CAT scan is about 100 times more radiation than a CAT scan. So you have to, you know, be careful with more radiation exposure because...
So how do we get rid of the cancer stem?
Well, there are treatments in the literature, green tea extract, ellagic acid, and phytochemicals in food have been shown scientifically to kill cancer stem cells.
And how is that admitted to the patient?
Food.
Just food?
Food. We are a food body first and then a supplement body. So food, you know, is our main cancer fighter.
Food is medicine and medicine is food. So is it given through enema? Is it given intravenously? Is it, I mean, you're sick, you know, how do you get the level of greens that you need to fight the cancer stem cells and the green tea extract. How do you do it?
All of the above, depending on the status of the patient. Sometimes we have to do rectal implants, right, because they're not absorbing. 80+% of our stage 4 cancer patients have gut dysbiosis. That means they're fermenting, they're petrification, they're not absorbing their nutrients. So even if they're taking a bag full of supplements, they're not being absorbed. And there are other treatments that we use that have been shown to kill cancer stem cell, and one of them is the viral therapy.
So is that a suppository that you had talked about earlier when you said a rectal implant?
That is implanting food. For example, we have a cold press juicer that cold presses the 9,000 pounds to cold press the food, and that juice is what we can and do implant rectally for maximum absorption.
I think we have to take a look at what Tony has said, because what he has said is really important. The cancer stem cells are very resistant to traditional therapy. So one of the reasons that the immunotherapy that we're talking about is very exciting is because this may be an important adjuvant treatment after the bulk of the cancer has been gotten rid of, whether it was surgery or other methods with biological therapy or antibody therapy, et cetera. So immunotherapy is going to be very important in this, and that's the reason once the cancer is, quote, all gone, that you have to talk about what other things can be done. We talk about in our patients all the time the nutritional approaches, including green tea, including other types of nutrients that are very protective against
now,
patients.
you say
Yes.
we, but that's you. Most doctors are not giving their patients these options. I wish they were more like you.
Get a second opinion when you need it. The introduction to this book was written by a very brilliant woman named Fran Drescher, and her story is in that book, and it's she's the poster child for you need to get a second opinion.
We have tons of great books in the bookstore from all of our guests, and all of the proceeds go to Cancer Schmancer because they were all generously donated by our speakers. I just want a big problem with people that have had some serious cancer treatment, cancer surgery, is trying to rebuild their body and get their weight back up. And I just wanted to ask Dr. Tony, because he had once said to me that, you know, he helped his mother. He said, there's no way your body is going to absorb the nutrients in the food that you need to build back up your immune system. So you were suggesting getting a stomach feeder as a additional thing, and your mother gained a lot of weight in no time.
And this is what's important, as the doctor is saying, to work with your physician, because we're medical doctors. We want the best for the patient, and no one can tell us that a patient can recover from anything, including cancer, if they don't have proper nutrients, because then the body can't have good hormone function, good immune system, and so forth, mental activity, right? So nutrients are important, whether we need to give them temporarily in the form of TPN, total parenteral nutrition, which is an IV drip to give them nutrients to the IV, or whether it's putting a feeding tube temporarily, or rectal implants. But we need for them to consume not only the nutrients, the calories, the enzymes, the probiotics, all that, for them to be able to heal, for them to have an opportunity, a better opportunity to heal from cancer.
And you'll hear from other people later in the program that Fran has so brilliantly put together about other nutritional approaches. We had a wonderful conversation over at my table, number 9, where we were talking about nutrition all the time that we were eating all of the food that we've had today. So nutrition is a really important part of the process. The very first time that I see a patient, I talk about diet, nutrition, supplements with the patients so they know when they can take certain supplements, when they can't, and how things go. Those should be questions that you take with your loved one who has cancer, or a friend, or yourself, God forbid, to your doctor to discuss these aspects of maintaining nutrition. We sometimes see patients who gain too much weight, and then we have the opposite, and we talk about exercise programs, yoga, meditation, things like that that are so very important. trying to bring these two disciplines together, traditional medicine together with complementary medicine, is really important for each and every one of you. So I urge you to make certain that you have the right advice as you go forward. The other thing that we should not eliminate from re-emphasizing to you is the spiritual component. I did a study with a medical student. She's now at Mayo Clinic, MD, PhD program, where we looked at our cancer patients who were survivors. And we said, what helped to get you through this? And number one was spiritual support. Believing that there's an optimistic, good outcome that will be done. And that's the reason I really appreciated your covering that as one of your 7 major points. We also saw that just having the commitment, the internal commitment to just do it. We went through meditation this morning, all of us together, and we said we have to commit to something that we wanted to do today. That commitment is very important. And the last thing is friends and family help to get the cancer patient through it. And I think that you all today are the leaders in your families and are friends to other people, and you can be the source of a lot of the motivation and a lot of the education that they need as they go forward. So take home a lot of stuff today.
If I could just say one thing.
Yes, of course.
It's 3 initials, FTI, failure to implement, right? Exactly what the doctor is saying. We need to implement what you've learned, what you will read in the books, and make decisions from your spirit, from that inner being of you, because science stops at a certain level, and we don't know the answers. But you have choices, you have options. Cancer is very rarely a medical emergency. There's time to think, there's time to study, there's time to pray, and then make an informed decision, but make it deep, heartfelt, maybe as we say, the Holy Spirit, guiding you into that.
I love that, this attitude, because sometimes, I think that big business tries to dumb us down of our inner voice so that we become dependent on what big companies, business, or government is telling us is good for us. When deep down we know it's good for us, you listen to your inner voice. That's closest to your creator. So take a moment, as Dr. Tony says, there is time. I just saw that movie, Sully. I don't know if anybody else saw it, but it was really great. And the Sully character said to himself, when the plane looked like it was going to crash, that there's time for everything if you just remain calm. And this guy was like, he had nerves of steel. But, it's a really valuable messaging, because just when you want to fall apart, that's exactly when you can't, and when you have to start thinking about everything. And if you have a doctor that's not incorporating mind, body, and spirit in your overall well-being, then maybe you should look to another doctor or get a second opinion or incorporate other support systems, because I'm telling you, as these 2 gentlemen are verifying, you can't have one without the other. Whole body wellness, healing yourself, and staying well has to do with a balance of the entire system, and all 3 components are essential and important to the human experience. Now, we have time for maybe 2 questions. So if you raise your hand, there are, I guess, microphones. Where are they? Oh, over there. Okay, great. So you're close. Go to that one. And let me just pick the second person. Anybody on this side here want to ask a question? Okay, you start making your way down to that microphone over there, and we'll have, this is my cousin Paula, who lost her mom to cancer. And
my question is really for Dr. Tony. Say, for example, your white cells are really low. You don't know what's going on in your body, but you know you don't have enough antibodies to fight infection properly. How do you go about building your immune system? I mean, how do you really, what's the foundation of building your immune system?
She's saying that if your white blood cells are showing up as being really low, how do you bolster that to build up your immune system so you're not vulnerable to all kinds of serious consequences, right?
Yeah, is it that system?
Look into the microphone so they can hear you.
You're the one in front of the camera. Is it the system that you had up early about nutrition, the whole mind-body experience, or what can you really do to collect antibodies?
The first thing is to rule out a serious disease or pathology. So make sure your physician, checks very well and rules something more serious out. Then you could do other things, right? And those 7 key principles are very important. But most importantly, to increase your immune status is nutrition, detoxification, especially in the mouth with metal fillings, amalgams, cavitations, root canals. They really depress the immune system significantly. We heard from Fran wonderful information about toxicity. The toxicities in our home are huge in depressing our immune system. And then most people are not happy anymore. And so we need happiness factors in our life. That has a great significance in elevating our immune system.
Yeah.
I go to a alternative dentist, and every single time I get a cleaning, I have them check in my mouth the level of bacteria in my mouth, and particularly if there are spirochetes in my mouth, because that is a mother of a bacteria. Very, very difficult to eliminate, and they're finding large amounts of them that penetrated the blood-brain barrier, in the hips, all over the body where we're seeing disease, these little suckers get into. So I've started using my water pick every morning with just a couple of drops of hydrogen peroxide to try and keep my mouth especially clean. And I use oral probiotics, as well as the gut is very important. Rebuilding the gut health is also very important. But thank you, Paula, for that question. And now,
Hello.
What's your name?
My name is Sherry.
Sherry, thank you.
And I think it's the same follow-up question, basically. That pie chart that you showed, you said one of the immune factors specifically worked for cancer cells. And I wonder what kinds of foods or what kind of products. You said you had developed a product, but what's special in it that we should focus on?
Well, there's many known substances in nature that improve immune function, but they have to be bioabsorbable. As we know, many patients come to us with a bag of supplements, and as I said earlier, it's very difficult to absorb. So this baseline nutrition is that. It's a nutrition that's fundamental, has 118 nutrients, including graviola. These are all from different parts of the world, non-GMO, no pesticides, no insecticide, all that. So it's the combination and the synergy of the ingredients in it. There's not much high doses of anything. There's just a good amount of synergistic ingredients, nice dosages, and also for it to be able to have maximum absorption.
That's the very important message that a lot of people don't realize. People do not know how to eat, or why indigenous cultures eat in the order that they do. Why in Indian culture they end the meal with yogurt, because it's full of live cultures to put back probiotics. Why certain spices are used to kill bacteria in the body while you're eating. And these are the things that we have to pay attention to. My ex-husband always used to say to me, everybody's using turmeric like crazy, but if you don't have it with a good fat and black pepper, your body's not going to absorb it. So you have to learn, how does your body absorb these things? Otherwise, you're going to have very healthy urine coming out of you.
That's right.
I think we also have to emphasize that in keeping your immune system strong, diet, nutrition, making certain there are no vitamin deficiencies that you're suffering from, especially with regard to low white blood cells. Also making certain that when it comes time for immunizations, to keep your body's immune system strong. Remember that a flu shot not only zaps up your immune system to fight flu, but it has another effect to zap up a lot of other immune systems as well. So make certain you keep your immunity up to date. Make certain now that you get your flu shots. Everyone should have one. Seniors should have the senior strength flu shot to zap their immunity up a bit more. Make certain that you talk this over with your physician so that you're up to date with all these things.
I'm actually, you know, I mean, I don't know about the flu shot thing because, you know, the disease control comes up with based off of the travel and what's the big flu that came up in China or whatever, what we have the possibility of getting, and that's usually what you're given, and then something else hits you, and you say, but I took my flu shot, and it was, yeah, but not for that flu. And, you know, I'm always saying to my parents, let's amp up on the glutathione, let's amp up on your other antioxidants like vitamin C. If you feel yourself getting tired, rest. I love that acocioxyacillin, which is a anti-flu, you know, homeopathic thing to put under the tongue. I tell them, take your vitamin C, drink when you feel yourself getting tired. And so, you know, and make sure that you don't stress, which will compromise your immune system, and make sure you fortify your body with a tremendous amount of healthy food that's organic. So, that's another point of view. That's what I do. Doesn't make me right or wrong. This journey is very individual. Don't turn anybody into a god. I'm presenting you with some different options here, and there are other options as well. So you just, you know, keep a healthy head and think for yourself. Don't make decisions out of fear. Make decisions out of knowledge. Knowledge is power. I want to thank these wonderful gentlemen because we have to move on with our program.
Thank you very much.
I love you. Mwah. Thank you, and thank you.
Happy to say, you know, no chemo, no radiation. He's been in remission on both cancers. It's almost 13 years. On November the 24th, it'll be 13 years.
Only got a month to go.
Yes, yeah, in a month, yeah, a month to go. And it's 13 years. And, you know, he didn't have to lose his bladder, his prostate, his intestines didn't have to come down, and no pump necessary, okay?